So the magnitude of Alzheimer's disease is enormous. From your perspective and given your background, what's the biggest current obstacle that patients and their families are facing?
Probably adequate education and availability of resources, certainly for families who are caring for patients with Alzheimer's disease. There's a lot of information out there, but it's not organized very well. So a major problem and obstacle for people is to know where to go to get the right resources to get the care and support, not only for families and patients, but sometimes for practicing physicians as well. So the physicians make the diagnosis of dementia or say Alzheimer's disease, and then what? You can contact the Alzheimer's Association, but people often don't know how to do that, and sometimes the resources are not readily available.
And then as you look at the same issue for the country, what's the biggest obstacle we're facing as a nation related to Alzheimer's disease from your perspective?
Well, I think the biggest immediate crisis is the growing numbers of people. So if the biggest risk factor for Alzheimer's disease is age, and we're facing an aging society, the baby boomers are now just aging into the period of risk. So this year, the 65-year-olds were the beginning of the baby boom edge, so people born in 1946. That's going to continue to grow through the people born in 1964. So if something isn't done, say on a research side of the house, to find treatments that are effective at forestalling this disorder, delaying its onset, slowing its progression, the system will be absolutely overwhelmed with people who need care for Alzheimer's disease. That's going to affect the individuals, the families, and society as a whole.
So there's several groups that are formulating recommendations around Alzheimer's disease and creation of a national plan. You're part of one of those. In the discussions you've had already with your group, what is your sense of what patients and families are looking for? What's their hope as we move forward?
Well, the National Alzheimer's Project Act has organized an advisory committee, and the advisory committee has three components to it. One is research, one is clinical care, and one is long-term services and support. And as part of the initial inventory in those three areas, there have been several excellent studies done, and some of the organizations like the Alzheimer's Association, the Alzheimer's Foundation of America, have actually gone out and have held town hall meetings to ask people what are their concerns, what do they hope for with the National Alzheimer's Project Act, what kinds of gaps are out there. And so a great deal of information now has been gathered, and both of those organizations, for example, have in fact put out publications that have summarized what the concerns are among the people out in the country, rural, urban, regarding Alzheimer's disease.
And what's risen to the top from your perspective in what they're asking for?
I think that disorganization with regard to care, services, where I need to go, where I can get help when I have problems with my family member who has Alzheimer's. How do you get an early diagnosis? How do you get a diagnosis first? How early can we identify it? Should we be identifying it early? Where's research on this? Research is saying one of the biggest stumbling blocks to moving forward at this point in time is lack of numbers of people to participate in clinical trials for new therapies. Recruitment for clinical trials is a very challenging effort, so consequently the studies are not being done as rapidly and as efficiently as they should be because the patients are not volunteering for the study. So there's a general education that needs to be done with regard to the value of research as well as where we can get adequate services and support for our families.
I know you're still in the process of formulating some recommendations, but from your perspective, what do we have to think about as a country?
Well, I think we have to bite the bullet about funding. So I think we have done an inventory and are continuing to do an inventory in those three areas that the Project Act is addressing. But the bottom line is the funding is inadequate across the board. I, of course, have a bias that I think research funding is horribly inadequate at present. So we typically cite figures about the annual research budgets for major disorders in this country. So cancer is about $6 billion a year. Cardiovascular disease is about $4 billion a year. HIV/AIDS, $3 billion a year. Yet Alzheimer's disease annual funding at the federal level is less than $500 million. So this is the disease that's going to cripple the country in the next decade or two. we need to drastically increase the amount of funding for research in Alzheimer's disease.
In the last, it doesn't even need to be 5 years, but say the last 1 to 5 years, are there examples of things that represent the right thing to do to tackle this big problem that individuals are doing, groups are doing, that stand out for you?
Well, certainly there is a great educational effort underway now to bring more information out to families and caregivers. For example, in this country, 25 states have plans for Alzheimer's disease, including Minnesota. There are 7 other states that have plans under construction. There are international efforts. Several countries have national plans, France being the most notable one. So there are examples out there of these efforts underway, and I think that that's going to help form the National Alzheimer's Project Act, because these people have given a lot of thought to these various issues. So I think that's a major accomplishment in the recent years. On the research front, we've learned a great deal about the earliest manifestations of the disease. What causes the disease, how early does it start, and what might be potential therapeutic targets. So now many studies are being designed to attack the disease at a much earlier point in the course. So rather than waiting for somebody to develop the full spectrum of clinical dementia, we're now getting at people at the mild cognitive impairment stage where they're just memory impaired, and we're even thinking about prevention trials where people are still asymptomatic or normal. That's how we will make a serious inroad into reducing the number of people who are afflicted with this disease.
And for those good things that are happening, what would you recommend we consider doing to more broadly disseminate those approaches?
Well, I think, again, the funding is a significant problem. So for these research efforts to come to fruition, we'll need the funding to get into these major trials, clinical trials now, that will involve thousands, maybe tens of thousands of people. But that's what we need to do, for example, with heart disease. Before we could conclude that cholesterol lowering was effective at reducing the risk for heart disease, we had to do those studies that involved 10,000 individuals being followed for 5 years. We need to do that. We can say we need to quadruple the research budget for Alzheimer's disease. It may not be there. This might not be the time to do that. Nevertheless, we shouldn't drop back and say, oh, we'll wait until it's convenient. It's never convenient. So I think the case has to be made for actually implementing many of these factors in spite of the costs that might be associated with them, because the cost of not acting is going to be far greater than biting the bullet and actually addressing these issues. But I think, without being too melodramatic about it, I mean, Alzheimer's disease may be the defining disease of our lifetime going forward. That if we do not get our hands around it at this point in time, it may in fact cripple the healthcare system as we know it now. We just flat out will not be able to afford to care for all the people who are going to develop this disorder, and the cost to the individuals and the families are also enormous. So I don't think it's a choice. I don't think it's a situation where we need to make stronger arguments for it. I think the people in Washington basically need to take the bull by the horns here and say, we have to address this problem and we have to address it now.
And one more thing, why don't you think there is the same level of urgency about this, Alzheimer's, compared to some of the others?
I mean, I think Alzheimer's disease is a chronic disorder. It's a chronic disorder of aging. And I think there still is that misconception about, grandma's just old. She's 80, she's 85, she's senile. Well, that's not normal. That need not be normal aging. So again, we have to educate the general population that Alzheimer's disease is not a natural consequence of aging. It is a disease, and we need to do something about it because we can improve those individuals' quality of life.